Today on my show, I'm delighted to welcome Dr. Maria Kunstadter, who is the president of the Teledentists. And Maria and I have talked a lot about different topics, and I'm really excited to really get you on the podcast, Maria.
Thank you. I'm glad to be here.
So I'm really interested. You have a long history in dentistry. You actually developed probably some of the first dental spas in our country. But a few years ago, you took your dental experience and segued into this crazy world of teledentistry here about now. What's interesting to me is, everybody in our industry thinks teledentistry is just invented with COVID, right? But you started this a number of years ago. Can you kind of tell me a little bit about how your journey has been and how you actually got into this technology?
Absolutely. And when I talk to people, I love to get my timeline of teledentistry because everyone, as you say, thinks it's something new. But what I always say is when the first telephone was invented, and it wasn't Alexander Graham Bell, it was an Italian in 1849. And there were two telephones, and one person on one end could say, I have a toothache. That's using telecommunications, talking about dentistry. So teledentistry has been around as long as the telephone has been around. Every office uses text messaging, emails, telephone communications. And now because of technology, we've added a video component. Doesn't make it new and mysterious. It's just adding the technology available to us to be able to communicate more effectively with our patients. So,
it's interesting. It's interesting you mention that because then if you take 10 years from now, when something on top of video is invented, that's just a continuum of teledentistry from the 1800s, basically, right?
Exactly. And then the University of Nebraska started a program early in the 1990s, and the Department of Defense connected TVs with telephones and all kinds of things. So this isn't anything new. It's just putting a mindset of how we can adapt this to using it for patient care better, because now we can visualize people. So as you say, thanks a lot. I've been in dentistry a long time. And I
didn't say how many years, right? You can see the same thing about me, by the way. So it's even.
But so I've been a dentist, and interestingly enough, my practice philosophy was training my front desk that when or if someone calls in pain, they were not to say, what insurance do you have, or how are you going to pay for this? They were just to ask the patient, how soon can you come in? Always been my practice philosophy, because it takes so little time and so little expenditure to help somebody palliate their pain and make them at ease with what's going on and take care of them. So that's always been my practice philosophy. But in the 2012-2013, I was appointed the dental director of a group called the Pains Alliance of Kansas City, which was going to be a national agenda to address the opioid crisis that was crashing down with patients with chronic pain. And of course, dentistry, we have chronic pain as well as acute pain. We have TMJ sufferers, oral facial pain sufferers, and you can go on and on with the pain that dental patients experience as well. So we were in Washington, D.C. at these big meetings and big conference tables, and continuously they had said over and over again from the podium, obviously people go to emergency rooms for pain, and in the top 10 reasons was always toothache. And me being the only dentist in the crowd going, well, that's crazy. There's no dentist in emergency rooms. They're spending a couple of $1,000s to maybe get an antibiotic now that opioids are being, taken off the offering. And then they're just told to go find a dentist when they leave the emergency room. And much to our experience in the dental profession, if that person legitimately wanted to find a dentist and the next morning dialed a dental office, back then they dialed,
right,
they would probably get a front desk person that would say, oh, I can get you in 6 weeks for an emergency exam. Will that work? And so the cycle of dental emergency pain was brought to my attention very acutely, that this is a very ineffective cycle. And at my table of people were a lot of physicians doing telemedicine. And it just washed over me that that's what we needed in emergency rooms, was a virtual dentist to address the dental patients and be able to get them into a dental office to address the patient being seen by the right specialist and being treated for the right condition in the right place at the right time. So teledentistry was born in our offices, and we decided to develop a platform to be able to take patients that don't come into our office, to be able to take more general public patients. So we developed the first teledental platform and tested it and did all the marketing and clinic trials with it. And then realized that this is a huge problem nationwide, and we needed a more robust platform. So we.
Now, I have a question for you. So it's interesting. Oh, by the way, we have similar experiences. As we've talked before, I've worked in electronic health records for years and years ago, and I was in the medical industry. And we were talking about electronic records and technology. I was like the only IT software guy with a lot of physicians. So I can certainly relate to probably how you felt being the only person in the room. But we digress a little bit. But anyway, so what I'm interested in, so at that point, there were no quote teledentistry platforms. And you certainly didn't have a technology company or a dentist, right, at dental spas. The technology that was available obviously was out of telemedicine. So segue a little bit into the technology it used. I would assume that being involved with telemedicine folks in those days, did you kind of embrace some of their technology from telemedicine and bring it forward? Or talk to me a little bit about the platforms and the technology that you actually incorporate.
Sure. So once we realized our little boutique platform wasn't going to be big enough to go nationally, we actually connected with a telemedicine platform for telehealth platform, and they white labeled it for teledental. And we, again, were the first teledental platform on the market. And so white labeling all this, we actually had the first teledentistry malpractice insurance policy ever written. So, it was a lot of firsts. But once we got into our telemedicine platform, which we are on with VC, which is a big international platform for telemedicine. In fact, they are the platform that provides telehealth for the space station. So I say we're with an interstellar group. So we now have a very robust platform that can take the demand, as it came. And so we launched with that in 2018, and then went direct to the consumer in 2019, so that people could go in to our site, be able to click on, fill out the telehealth information. We develop an entire chart for patients, with telehealth, medical information, dental information, chief complaint, medications. All those things are part of our platform to make sure that we're providing a comprehensive health care specialty.
Maria, it's real interesting you mention that, because I myself, I was involved in the late 90s when I was in IT and software and EHRs and all that good stuff with the University of Washington up here in Seattle when they first started doing telehealth, because we have a lot of rural areas, Alaska, Montana. And so it was real interesting to me. And then when I got more heavily involved with teledentistry a few months ago, because a lot of my clients said, hey, Mike, look at teledentistry. It's something we might want to use. I always thought that, it's like medicine and dentistry. It's like, why do we have this thing, telemedicine and then teledentistry? Shouldn't it be telehealth? And then there's the dentistry version of that, the medical version, maybe the behavioral science version, but it's all telehealth, which leads me into the most exciting part for me of this podcast, because coming from medicine as you have, or not coming from medicine, but having worked in the medical industry as a dentist, doing teledentistry, and myself coming from EHRs and medicine, I'm really interested in the opportunities that telehealth provides for the collaboration between medicine and dentistry. So you're very uniquely qualified to talk about this. So I'd like to segue a little bit, because I've been pounding this drum for years about the collaboration between the two disciplines. Talk to me a little bit, first on a high level, and then I'd like to get into the detail of what you're doing in the teledentist, but talk to me on a high level about how this telehealth concept can really support healthcare in general, the crossover between dentistry and medicine.
Absolutely. And key point, we belong to the American Telemedicine Association, and we've exhibited there. And when medicine companies come through, I said, my spiel was, you cannot call yourself a telehealth company if you don't integrate oral health, because you're absolutely right. Oral health is a specialty of medicine. I mean, we are healthcare providers, and it should be another specialty offered in a telehealth company, and should be offered at every level. And in fact, Mike, the important thing is to understand is there's 108 million people that will see a physician this year and not a dentist. So the integration of oral health and primary care and oral health and healthcare has been called since the Surgeon General, Dr. Koop, said we must include oral health in healthcare, and that was in the year 2000. And then the Academy of Pediatrics, the Academy of Family Practitioners, the IMO all said oral health must be a part of primary care. And in spite of this call since the year 2000 and the constant research about the integration of the impact of oral health on a person's total health, it still was studied by DentaQuest last year how many children, even though the Academy of Family Pediatrics say it must be part of their primary care, they did a study and said that only 7% of patients had an oral health experience in a primary care practice. So we have a 97% curve we have to impact by being able to talk to patients. And then on the flip side, 28 million patients will see a dentist and not a physician in a year's time. So we need to have dentists more integrated with medicine and medicine more integrated with dentists, because as a dentist, we've sat in our offices, working away for too long. We need to look at the better broad picture of oral health and primary care.
It's interesting, Maria mentioned that. When I was working for years in the medical software industry, right before I segued into the dentistry a few years ago, I had a lot of primary care physicians I knew and docs, and they used to talk all the time about how people would present with oral health issues, and they would send them down the road to some dentist they knew. But they said, boy, you know what? If we could communicate with that dentist electronically and we could manage the case together, they said, you know what? I would probably send all my oral health referrals to that dentist. Point being that even if you take the patient care component, it's just from a sheer business standpoint, referrals, it's a benefit for dentists to work with physicians electronically, right?
Absolutely. And the reason, we all know if people don't talk about subjects they're not comfortable with. So in my office, I had two hospitals that their employees would converge and come to our office, and they always would go, yeah, we know oral health's important, but we don't know what to do about it, so we don't say anything. And that's pretty much the common complaint of other specialists. So now with like the teledentists, they can take a tablet, and I say when patients are sitting in an exam room with just tissue paper wrapped around them waiting for the doctor to come into the room, the staff can say, when was your last dental exam? Which should be a question on every healthcare questionnaire, because if it's over a year, that person needs to be referred to a dentist for cleaning and checkup and follow-up. And if the patient says, oh, I don't know, or it's been over a year, hand them the tablet and let them engage in a teledental consultation before the doctor even gets into the room, so that when the dentist consults with the patient and we get them actually appointed into an office, then that whole event can be put into the patient's chart as a dental consultation to show, and the doctor can look at it and say, so did you go to this appointment to have, your teeth cleaned? And that will be part of the dynamics of the medical side. And our launching in December, we're bringing medical people on our platform into dental offices, because for several years now, dentists have been encouraged to do blood sugar levels. We've always been encouraged to do blood pressure checks. And then what? If you can't prescribe, or you shouldn't prescribe hypertensive medications or diabetes medications, the dentists have to then refer to a physician and hope the patient goes. Right. Or in our case, they'll be able to click on talk to a physician and be able to consult with an internal medicine doctor about their unrelenting hypertension.
So,
and we can.
So I have a question for you. So from a people standpoint, this crossover, right? I'm always interested in, we're trying to bring oral health into medicine. We're trying to bring vice versa, really, is what you're saying, right? Is it, what are you finding? Do your medical counterparts reach out to you at the teledentist? You reach out? How do the two come together typically on different pilot projects and all the exciting things you're talking about that need to happen and are happening? Where does it start from? Where do these conversations start from?
Well, I've been, until COVID, pushing this giant boulder up the hill,
Okay.
getting, talking to telemedicine companies, talking to hospitals. We're
I wish I
going
would have
in
met
more.
you about 8 years ago, and I started doing the same thing myself. We've been going on different hills, rolling the boulder up
We
differently.
need
Now
to do
maybe we
this
can do it
together.
together.
But fortunately, COVID took the boulder and it's now
Thank you,
going
COVID.
downhill rapidly. But fortunately for us, not fortunate for anybody else. I don't want to diminish that in any way.
Right.
But, we're actually, and then COVID delayed us. We're starting in our first big medical healthcare facility up in Michigan soon in this year, to put in 3 emergency rooms and 3 in patient consultations for,
Wow.
again, when you look at statistics and research on post-operative pneumonias, because you take a patient without having a dental consult and shove all the bacteria down in their throat with the intubation tube, the statistics show a higher incidence of post-operative pneumonia with poor oral health. I mean, that's kind of a duh. So, talking with this hospital, it says you need to do your surgical anesthesia screening and your oral health screening on elective procedures before, 2 weeks before, so that can be addressed and reduced post-operative pneumonia, which, as you know, hospitals are done if a patient leaves and has to come back. And that's what happens with post-operative pneumonia. They dismiss them, they go home, and they develop pneumonia, and they have to be readmitted. And that's a huge economic loss for the hospital itself and patient loss. People do die of post-operative pneumonias and incur huge medical expenses. So, that's really what you call about integrating. And then the other thing on integrating this is now that you can have a tablet and carry a virtual dentist around in the hospital, there was a great study done a year ago that showed a 90% reduction in hospital-acquired infections by having mandated toothbrushing twice a day in the hospital. And those kinds of statistics should stop medicine. Stop, we got to take a week, we got to do this. And trying to get hospitals to listen to the research and act on the research. And we have tools that has a monitored toothbrushing program by scanning the toothbrush. Every time the toothbrush is used, if you've been in a hospital, you get a little plastic toothbrush in your kit, but nobody ever asks you if you've brushed your teeth or if you're using it and you're sick. And again, I have to do visuals. You can tell I talk with my hands all the time. Patients laying in the hospital going, without brushing their teeth, and the bacteria is growing and the biofilm's growing, and they're
Okay, so
inhaling.
I have an important question for Maria, since you
Please
talk with your
ask.
hands. Okay, this is really important, right? As a patient of yours. So if I'm a patient of yours and you talk with your hands, how do you do that when you're in my mouth? How do you learn that? Take your hands out of my mouth as you talk to me? This is a really germane technical question, since you brought it up.
Well, I usually sit by the patient, and in case you hadn't noticed, I really get to know people really well before I start drilling on them. But I do carry the dialogue. A one-sided conversation, I get my way all the time when I'm working on people drilling, because they can answer me back. But part of what I love being a teledentist now is I could not operate with all this gear separating me, sterile from a patient.
Right.
I couldn't do that. Obviously, there's just no way all this can go on behind a shield, mask, loops. So I'm really glad to be able to talk to my patients.
So I have something I'm really interested in. We'll probably have this term more and more used, a virtual dentist or a teledentist, which could be a strict person that just does teledentistry, or a doc that works in an office and does teledentistry as well, right? When you look, okay, obviously not everybody, well, just like when I switched from doing live seminars and webinars to doing, online webinars, right? It took a while to get used to a different format, right? When you look at a teledentist, when you folks at the teledentist look to hire and bring on teledentists as part of your network, number one, what kinds of qualifications and skill sets do you look for? And what's the learning curve? Because obviously it's going to be a heck of a lot different doing what we're doing, right, with a patient than sitting in the chair. And I'm really interested in finding out how all that works.
Good question. Well, we have a team of 300 dentists across the country that we credential based on their licensing, their national data bank, and they send all those the credentialings to us to make sure they're don't have any outlying problems in terms of patient report, and they have their license. Then we do a training, just like we're doing with you, to see what their ability to communicate on computers and through a patient is. And we have a solid 300 dentists that are currently working with us, and there are the most diverse and forward-thinking dentists. I'm so proud to be a part of that group, and have them working with us. And it's a great experience. Now, we do, at the end of all of our consults, there's a rating that people can rate their consultation, a 1 to 5 star. And if somebody gives, less than 5, we are at a 4.95 something rating. But when something happens and we get a lower rating, we go back and look and see who it is and see if there's a problem there. Most of the time it's connectivity issues, that the patient doesn't have the bandwidth, and sometimes it doesn't go as smoothly as the patient would like. But rarely is there any complaints about any of our doctors, but we do stay on top of that.
So I have a question for you. So we're talking a lot in this podcast about medical and dental, right? In the exciting world of collaborating finally with medical colleagues and dental colleagues, right? So when you think of your network of dentists, okay, and I'm thinking about collaboration where a patient seeing one of the general or your teledentists might need a cardiologist or whatever, right? Are you going to be bringing on, and not necessarily bringing on to your network, but will you have collaboration with, quote, telemedicine folks, right? So basically, if you need a cardiologist for a consult or you need some other kind of medical specialty, will that person be readily available within the network? Is that kind of something you're working towards?
That's what we're launching in December. We're just doing our negotiations with a telehealth company that provides all the specialists, and that's what we'll be able to bring that into dental offices. So if they do need to talk to a cardiologist, or they do need to talk to whatever, an internist first, and then the internist may bump them all up to what needs to be done, and they monitor chronic disease patients like diabetic patients, so that from the dental office they can get their prescription for their medication that the physician recommends, because the physician can do the diagnosis and on the medical aspects of it, and knowing that the patient's getting good oral health. Again, the statistics and the research about the correlation is just so dramatic, that it's been shown to decrease risk factors by improving oral health by 25% in chronic disease patients, reducing healthcare costs by 17% by integrating oral health in primary care. And we're doing it. We're actually bringing a telemedicine group onto our platform and working with them and our patients, and offering that to dental offices. And again, we're always trying to work with medical offices so they can have a dental connection.
So I want to book a date in the future with you, because after a couple of months of that project, I want to get you back on, and I want to get the medical folks back on to talk about it, because what we need more of, right? A lot of us talk about this connection, and especially using technology. I mean, if it wasn't for the technology, the cloud technology, the EHR technology, we wouldn't be talking about this, right? Because this has been going on for years, but we finally have the technology. So, you and I, we could probably have a 10-hour podcast on this. However, I think most folks are ADD and they wouldn't sit for it. So what I'd like to do, I definitely want to talk to you again about this and other topics. But before we go here, I'd like to kind of you to put on your crystal ball or visionary hat, especially how technology, specifically teledentistry technology, will progress in the idea of collaborative efforts between medical and dental. And talk to me kind of your vision over the next, 2, 3, 4, 5 years, how you think that will play out just in general.
Well, I am very passionate about this, as you might have guessed. And my vision is to put a dentist everywhere a dentist should be, which is part of every medical team. And because there's not enough physical dentists to do that, but there are enough virtual dentists to go with the cancer team, around talking to patients that are going to start cancer treatment. And we know that they need to have a good oral health in order to enter into cancer treatment, radiation, chemotherapy, and have the dentist respond to the patient's oral pain that they're having from the chemotherapy. So putting a dentist everywhere a patient should be is our goal. And in order to do that, we can do it virtually. So it's a big goal, and again, we want to work with pediatric groups and maternal and infant physicians, because they're going to see the mother, and reducing pre-weight and premature babies can be a 34% reduction by improving the oral health of the mother before the baby while she's pregnant. So the impact of having a dentist as part of the healthcare team is my goal, and I believe that, as you said, it needs to be, dermatology, oral health, behavioral health as a telehealth provider. So
right. It's real interesting because when I worked in medicine with software, I worked with a lot of FQHCs, federally qualified health centers, community health centers, helping them get EHRs and software technology in medicine. And it's really interesting because my experience in medicine with those community health centers, they typically have a medical side, a dental side, many times a behavioral science side. And it was really interesting looking at technology. Many times I would sit down with a large FQHC, they'd have a medical side and they'd have, hey, Mike, can you help us get an EHR? And then the dentist wouldn't be at the table. Right. It would be, but I think things are changing. And now that we have teledentistry and especially cloud technology, that'll really help kick that up on steroids. I want to ask you a favor. Okay. Mm-hmm. So since you said oral health is a part of healthcare in general. Yes. I've been talking for years. When I first came into dentistry from medicine, mm-hmm. I talked about that idea because I came from medicine, right, and dental technology. And I said, hey, look, guys, I know dentistry is a discipline, but it's a gigantic specialty of healthcare. It's just really large. It's not any different than cardiology, than other things. And I, to this day, still get flamed out. People call me up and they say, no, Mike, it's not a specialty. So can you please support me in that effort to say that, hey, dentistry should be a part of healthcare, what you call a giant specialty. Oral health is a giant specialty, and we need to bring it into the fold, especially with technology. So I'll ask you that favor.
So one thing I do in talking to hospitals is a person comes into the reception in the emergency room with a broken arm. And this is my conversation with medicine. I said, patient has a broken arm. Do you call in the cardiologist? No, you call in the orthopedic surgeon. Patient comes in, I have a toothache. Why would you not call it now that they have, the access to a virtual dentist? Call in the right specialist for the patient, for the presentation of what's going on with the patient. And Scott Lakin, who was the insurance commissioner for the state of Missouri, I'll give him, he's no longer in that position, said a while back, pretty soon it won't be, did the patient have a dental consultation? It will be, why didn't the patient have a dental consultation? Because the access, you can do it virtually, is with any computer system. And the access of doing it virtual dental, teledental consult is available now. And the impact of not having a dental consult, is staggering, and improve patient outcome and reduce liability risk by having a dentist as part of the team. So if they start thinking liability and knowing that this is a specialist they should have called in, and once that becomes a risk determinant, maybe they'll come to their attention and they'll realize we need to do this. But commonly we hear, we can handle that. We just brush them off and send them away.
Right. Isn't it funny how the term liability makes a lot happen when, for years, as you know, I've been involved with the EHRs and e-prescribing. I started working with e-prescribing in about 2007, 2008. When I went to dentistry a few years ago, I'd speak at conferences about electronic prescribing. And a lot of the dentists would say, well, I don't need that because I only prescribe, I'm not a general family physician, I only prescribe 2 or 3 meds, right? And I said, yeah, but you don't understand, e-prescribing gives you contraindications. They say how the drugs interact. And I go, if a patient's sitting in your chair and they go home and they die because you give them a drug, you're still liable. With e-prescribing, you'll protect yourself. And they go, really? And so the point is unfortunately, liability does make people's ears perk up, right? About certain things. Absolutely. So, well, listen, this has been wonderful. Every time I talk to you, I really get a lot out of it, and
Well, I
love
enjoyed it
talking to
too,
you about this
very
stuff.
much.
So,
We have
so
a
again,
date for 2 months from now.
yeah, really.
Well,
Well,
I'll
sounds
bring
like
in
you have
my
a lot of
medical team. I'll bring
sounds like
my
you have a lot of
medical.
pilot projects going on. So, what dentistry needs is a lot of use
Yeah,
cases.
absolutely.
So, yeah. So, listen, thank you again for being on my show,
Thank you.
and I look to talk to you in the future.
All right. Thanks a lot, Mike.